Third hour of the Elias Macko Show. To fourth jab or not to fourth jab? That is the question. Do you need a fourth jab dose of the COVID vaccine? All adults in Quebec can now book an appointment for a fourth dose of the COVID-19 vaccine if they want it, even if it's not officially recommended for most people. That was the announcement from the health minister last week. So, do you need one? Dr. Matthew Oughton is on the line, infectious disease specialist. Dr. Oughton, welcome back to the show.
Oh, thanks for having me back on.
So, I guess it can sometimes be confusing because you hear recommendations and then you hear for certain people and then not, and then you read a story about efficacy between second and third versus third to fourth. So let's try and break it down here, Dr. Oughton. What are you telling people right now?
Okay, so what I'm telling people is that for anyone who has particular severe risk factors for severe disease, and specifically, really that to my mind includes people who are older, and by older I would say 70 and above, people who are particularly immunocompromised, either because of medicines that they take that work by suppressing large portions of their immune system, or by diseases they might have that affect the function of their immune system, that in those people, certainly a fourth dose adds at least something, understanding that those are the same people in whom they're not going to respond as well to any of the doses, but some of the response is probably better than no response. But that overall is a fairly small proportion of our entire population, and that for most people, absent extremes of age or major problems with their immune system, certainly unquestionably 3 doses of one of the approved mRNA vaccines is probably the preferred vaccination strategy, but that an additional dose of the current crop of vaccines we have, a fourth dose, adds very little in terms of the overall sort of breadth of protection or duration of protection, especially when it comes to protection against severe disease.
So, Dr. Oughton, I was someone, as soon as I could, got my first dose, as soon as I could, got my second dose, and then I think it was 6 months after I was, they said, okay, you can get your third dose, as soon as I could, got my third dose. Did those 3 doses right away and was told to do so. Fourth dose, nobody's told me, hey, you should get a dose. As, of course, I'm listening to what you just said to us. So right now for me and what I do, and I'm okay with holding off. Right, that is the right thing to do.
I believe that that's the correct thing to do for the vast majority of our population. The way I've said it in other venues is that there's clear additive benefits to getting that third dose over getting a second dose. But for most people, the benefits of getting a fourth dose are very, very minor. Again, assuming that we're talking about the vaccines that have been and continue to be used right now. My advice might change if and when we have a new crop of vaccines that are better matched to the currently circulating variants. There is work for those sort of more variant-specific vaccines that are that work is underway, but it certainly hasn't resulted in a fully approved sort of variant-specific booster. So for right now, for most people, go and get your third dose if you have not had your third dose. And it's still, to me, stunning to look at the Quebec data and say that I think it's only 54% of the vaccinated population has had that third dose. That means we still have another 46% of those in Quebec ages 5 and above who could get a third dose. Those people should go and get that, whether or not we are in the downswing of a wave right now. You could argue that there's no better time to prepare than when things are quiet, because as you were alluding to earlier, you go and get your dose and you still got to wait, a week or 2 weeks to really have that full protection. But I'd far rather people get that full protection before they need it, rather than after the virus is surging in our communities.
Now, I noticed you mentioned age as a particular factor there for those who should get the fourth dose right now. I have a question here from a listener, and I think it's an interesting one, about how much maybe the type of work one does should influence a decision here. So I have a note from a listener. I'm a school teacher in my 30s, right? And she writes me, should I get the fourth dose? So what about jobs? What if you're doing a job where there is a high risk factor in, let's say, the school setting or the healthcare setting, something like that?
So it's a good question, and that's looking at, as you point out, the risk of sort of overall exposure. In this case, based on your day-to-day activities, it doesn't really affect your immune system's response to vaccine, nor your likelihood of developing severe disease. I think this is in part why we've seen such what's the way to put this? I think this is why we've seen little in the way of clear recommendations. Yes, now in Quebec, you can go and get your fourth dose. You can book your own fourth dose if you want. But the reason why there's not strong recommendations for sort of the average healthy community dwelling person is because of that lack of compelling data that a fourth dose really adds a lot. Unquestionably, 3 doses is what you need to protect yourself against disease, and especially against severe disease. And certainly for the school teacher who writes in, if I'm assuming they've had their third dose. But I would say beyond that, I don't think that there's any particular harm other than the usual side effects that come with getting any vaccination, any booster, which really are largely sort of the short-term injection sites, tenderness, maybe a day of mild fever or mild fatigue, and that's about it. I don't think there's any evidence at all that there's a substantial risk of harm from getting that fourth dose. I just don't think that it's going to protect you a lot. I think you're far better off to rely on other means to protect yourself. If you're a school teacher, for example, that would involve making sure that your classroom where you spend most of your day has got excellent ventilation, which at least these days with this kind of weather outside means that you can hopefully open up your windows and get good circulation if your building's HVAC system is not really up to snuff.
We are with infectious disease specialist Dr. Matthew Oughton. Coming up next on the Elias Macko Show, we're going to be speaking with an organizer of an Amazon labor union in the U.S. Dr. Oughton, on fourth dosing, for third dose for children. I have a question from a listener about kids. Do kids need the third dose?
So I'm going to preface all this by saying that I am not a pediatric doctor, right? I deal with adults, and children are their own sort of specialty. And as far as I'm aware, with my lack of expertise in the pediatric field, the same general advice holds true that for most people, certainly third dose, for any approved group is important, but beyond that, a fourth dose, same thing, is not generally strongly indicated, except if they have particular risk factors for getting really severe disease or really not responding well because of weaknesses of their immune system.
So let me ask you this as we wrap up this interview, Dr. Oughton. Do you see, long term, we're basically going to end up in a spot that's similar to what we do with the flu vaccine? People at risk, especially important for older people, every year get your flu shot. Will it be like, hey, you know what, as you get older, people who are at risk here, go get your flu shot, go get your COVID vaccine shot? Is that where you see this heading?
That's a good question. And it's you choose an interesting example here. It could head that way for a while, keeping in mind that I would say that what we've seen over the last almost 2.5 years is that SARS-CoV-2 seems to be more able to come up more rapidly with variants that are even more transmissible than most influenza, and at the same time more able to overcome immunity, at least to a partial extent, than what we've seen with most influenza. I'm saying it that way because, of course, we do have on occasion pandemic influenza, which is, perhaps it's a less common thing, but that probably more closely mimics what we've seen happen with SARS-CoV-2 in the last 2 years. So it could come that way, but I suspect both with flu and with COVID-19, we will eventually have vaccines that will provide us with longer lasting, more durable infection against a broader range of strains and variants, which then might get rid of the need for repeated, regular, seasonal or annual boosters.
Dr. Matthew Oughton, infectious disease specialist. Always a pleasure talking to you. Thank you so much for your time.
Thank you, Elias.